And now it is my privilege to introduce to you the first keynote on this year's forum. Cathrine Lofthus is a medical doctor with broad leadership experience from all levels in healthcare. She is the first vice chair of the executive board of the World Health Organization. She is chief medical officer of Norway, and she is the director general of health in Norway. So please welcome Cathrine Lofthus.
Thank you, Kari-Anette. And wow, how great to be here. It's full, it's unbelievable, and it's extremely important that all of you are here. I'm so thrilled to be here. And I also want to start to reiterate and emphasize the friendship between Norway and BMJ. That's already mentioned. And I'm really, really pleased to see so many of you here at Nova Spectrum, where we have come together for the International Forum on Quality and Safety in Healthcare. This event is the largest international conference in Europe, focused on improving outcomes for patients and communities through quality improvement. Extremely important. And under the theme, The Power of Us, Strengthening Systems and Deepening Resilience to Improve Quality in Health and Care, the program brings together over 2,000 global healthcare leaders, innovators, patients, and practitioners to share our knowledge and drive real-world improvement. And I am really passionate about human encounters like this, where we join focus and look for common ground and hopefully common solutions to what I believe in many cases are our common challenges. We are sadly living in a time that feels extraordinary, but it is rapidly becoming our new normal. The instability of today's geopolitical situation affects emergency preparedness and supply chains. And as in many other countries, Norway's demographics are shifting fast with an aging population. Patient complexity is on the rise, access to healthcare personnel is diminishing, and our digital vulnerability is something we must take under consideration every day. These are not temporary deviations from the norm, but a lasting state that imposes ever-increasing demands on our healthcare system. Our system must be resilient, continuously adapted and safe, no matter what the world looks like. And the need for collaboration across borders is a global challenge and is more needed than ever now. No institution nor country can achieve an ideal outcome or ideal healthcare system on its own. So today we are here to create that dialogue and cooperation and to align forces where we can, to make changes for the better worldwide, to learn from each other. And for true change to happen, we must truly listen to each other. The World Health Organization emphasizes that learning and continuous improvement are the foundation of good patient safety and the very engine that drives the development of resilient services. In this, there is an important human perspective. Culture is a cure. A system that lacks psychological safety can lead to more adverse events and hence more patient harm. In addition, it can lead to demotivation and anxiety among healthcare workers. So the work environment and the condition we provide for healthcare workers have a direct influence on the healthcare we as a society are able to provide. If it is not safe for an employee to speak about their concerns or admit mistakes, it becomes less safe for a patient to receive help. A phrase borrowed from the 18th century English poet Alexander Pope, "To err is human," has been guiding the work on patient safety and quality improvement for the last 3 decades. People make mistakes. It's human. And sometimes things happen that should not happen. And a patient is harmed as a result of an error. In the aftermath, we must make sure to take care of all involved. At the Directorate of Health in Norway, we have therefore developed and published a national guide to contribute to better care of patients, users, relatives, and employees involved in adverse events. I really believe that good care for everyone involved in adverse events will build a more open and learning culture in our healthcare services and will help to reduce the number of patient injuries and other adverse events. And as healthcare workers and leaders, we must have the ability to admit our mistakes and give a heartfelt apology to patients and relatives. So we are really proud to present the National Guide this afternoon in the session on caring after harm, building resilience and safety culture through second victim support. I hope you will listen. In Norway, we have set clear directions for the work on patient safety and quality improvement through the establishment of a national framework for the entire health services. The framework is based on the World Health Organization's Global Action Plan for Patient Safety, and it has 3 main goals. First, it must be safe to speak up. Secondly, learning and improvement must be carried out systematically. And third, the number of patient injuries must be reduced. Leaders have a special responsibility to build a culture of learning together and to ensure that the principle of continuous learning is given time, space, and priority. It is a sum of our daily improvement, learning points, and reflections that leads to greater preparedness and lower risk when it really matters. Many of you here today are familiar with Professor Baltodden's well-known statement, "Everyone in healthcare has 2 jobs when they come to work: to do their work and to improve it." On a busy workday, where new needs are constantly being identified, new technology emerge, and new situations and risks arise, we must never lose sight of the most important thing: safety, comprehensive and good patient care. We heard about the football team, Liverpool, so I also will talk about team, how to work together. For me, I must say that football is about my daughter and the local football club, Skogsholm, which you have never ever heard about. But now, being a Norwegian citizen, it's also about the Bodø/Glimt, the Norwegian team I think you've heard about. Hard work, humility, and collective responsibility is the philosophy under working together that Bodø/Glimt has as their winning formula. And it has resulted in repeated league titles and major European football achievements. So we are quite proud. We think forward Play forward and run forward, they say. And this systematic approach to quality improvement can create results far beyond a football stadium. We see it at the World Health Organization, on the football pitch, and in health and care services. Improvement is a team sport, locally, nationally, and internationally. We must dare to take chances, invest in and build relationships across boundaries, and in this way, we can all be part of each other's solutions. Because no health services is faultless, there is always room for improvement. But we stand stronger in the face of the challenges ahead if we do so together and with ambitions. We must have ambition. And this requires courage from us all to find new solutions when needed. Digitalization and artificial intelligence give us enormous opportunities, but only when used properly. To exchange experiences and results nationally and internationally, to help healthcare personnel in their daily work, not replace them, and for real-time working and learning, safer workflows, and increased safety. And this is our conference theme, the power of us in practice. Global health gains are fragile. We have conflicts, climate change, constrained budgets, and misinformation. And this can all easily erode what has been built. So protecting these gains requires steady investment in research, innovation, and delivery, and in resilient national systems. I can feel like the ground under our feet is ever shifting, but our shared mission remains constant: to protect and improve health for all. And if we keep science, evidence, equity, and people in the core, at the core, if we dare to act and continue to invest in innovation that is local and accessible, if we match our ambition with humility and collaboration, better healthcare for all will not just be a vague, distant destination. It will be our new roadmap to the future. So, in conclusion, I would like to leave you with the following 3 messages. The ability to learn is our superpower in turbulent times. Quality and safety are built by people, not systems alone. And we create safer health services when we learn together and listen. Truly listen. The greatest patient safety risk comes from what we don't see, don't hear, or don't find out about. Patient safety depends on communication, the relationship we build, and the feeling of being seen, heard, and taken seriously. The trust this builds is one of the most important factors for safety. And the consequences of not listening can be fatal. And sometimes the worst happens before we understand that we should have been paying attention. So now I want to draw your attention to the Norwegian twins, Mina and Milla. They become household names overnight in January 2023, when they died, age 16, while in the care of child welfare services. They had struggled with mental illness, eating disorders, and substance problems for years. And in Norway, and all of us, of course, we asked ourselves, how could this happen? Their story is a really painful example of what can go wrong when procedures, forms, and unclear boundaries between professionals and areas of responsibility become more important than the people they and we are supposed to serve. Following the girls' deaths, the mandate of the Norwegian Board of Health Supervision has been expanded with the establishment of a new national unit for child protection. Someone who knows Mina and Mille and their case well is the Director General of the Norwegian Board of Health Supervision, Sjur Lehmann. We have invited him here today to reflect on what we can learn from the events of January 3 years ago. But first and foremost, this is the story of Mina and Mille and their mother, Kirsti Skogsholm. Kirsti is here today and will tell us about her girls. And after the presentation, there will be a discussion led by Gabriella Matthews, who is a doctor, a young people's health advocate, and a long-term patient herself. And I must say, we urge to listen closely to the stories and reflection you are about to hear. It may make the difference between life and death for someone else's child one day. Thank you, and good luck with the conference.
Hva fikk deg til å melde i mitt svarteste sekund? Selv sommerhimmelen gikk helt inn i seg selv da. Du vet hvordan jeg blir, jeg bare later som at alt bra.
Det bare sånn du slipper Mille, og så du slipper nå.
Hello, everyone. Before I start, I'd like to say something about the song you just heard on the video. Me and my girls, we listened to a very famous poet and singer from Norway, Trygve Skau. And when my kids, in the funeral of my kids, I wanted him to come and sing, and he did. And when my girls were supposed to turn 18, I threw together a big concert in Norway. Over 4,000 people came to the concert. And then Trygve Skau made that song you just heard for me. So every time I'm around doing my thing, I play this song because it's a very important song for me. And then it's time for me and my story. We were a nice little family of 3. I have been a leader since I was 19 years old, and I'm confident in the role, and I'm used to the responsibility. My girls were 2 very happy girls with a large circle of friends. They excelled on the handball court, and they loved everything with 4 legs and fur. From the time they started in the 2nd grade, they regularly went to the public health nurse. They struggled to put into words the things that were difficult. But despite everyone already then talked with them, there was no one who caught them, and no one had the right questions. They were subjected to their first abuse at the age of 13. It would be the first of many. And here the public health nurse noted the difference in the girls. They tried to tell, but they could not find the right words. And neither did those who treated them had the will. We are not going to go into why they got sick. We are just going to get their weight up. That is our assignment. And that is how we entered the system. A system I believed would help us, but instead made me the problem. I, who had always been resourceful, the one who had always had the overview, now become the one who hindered the treatment. My girls suddenly became behavior children, and I became the mother who suddenly did not cope. I did not cope with the life as a mother, they said. This is in the best interest of your children. You do not manage this, they told me. And at the same time, our everyday life is now filled with violence, chaos, and suicide attempts. But the attempts was not carried according to the book. Therefore, the attempts were not taken seriously. They are just doing it for the attention. Then come the statement. They do not benefit from hospitalization. But what would they supposed to benefit from then? I'll stand in all the emergency departments and hear my girls scream, I just want to die. Let me die. And now I notice the change in those works in all the places, because now substance abuse enter the pictures. Overdose with drugs become our everyday life. And now I notice how they talk with us with contempt, as we did not hear and did not exist. Security guards were ordered before we came in. They stripped the rooms and gave the girls only a mattress. They are put in handcuffs for the slightest little things. It is expected that things will go wrong, and then they did. The girls are scolded when they shout, because here in the emergency department, there are sick people. But what were my girls? Then we became people like us, the kind that no one wants to have in their home. The girls were denied coming into friends' home. I became the one that they avoided, the one they stopped greeting. And how I wish somebody who saw me, that somebody would lift up the gaze, seen the frightened and exhausted mother. If only someone could have said, this is not your fault. One time, when myself was subjected to violence, I ended up in the emergency department. I was terrified and I was crying. And the nurse who hears me say, I hear you crying. Do you want something to calm you down? No, I did not want that. I wish I had been brave enough to say, I want you to sit here. Hold my hand a little while. Say that this is not my fault. That is the illness that makes your children do what they do. But she just left me. So after this, I started to lie. I say I fell in the stairs. I trapped my hand in the door. No one asks, and no one catches me. When my girls are actually placed for the first time, we had a week of repetitive suicide attempts. And when the police drives away with my girls and left me standing in the parking lot, completely alone, that's an image I can't get rid of. And when my girls die, I don't need to tell you who takes the blame for that, because I do. Because in the medical record that I now get to read, it says it's black and white. Mother is difficult, mother is hindered the treatment, and mother do not prevent self-harm. And this became my sentence. But then the report came. the one that says it plainly. It was not me. I was not difficult. But I was the mother that asked the difficult questions. I was strong and never gave up on my girls. But I believe everything that was said until the report set the upside. So here comes my turning point, because the truth came out only far too late. So, dear people, what can we learn from this? That patient safety is so much more than procedures and forms. It's also about attitudes and seeing people, and not just diagnose, about listening to us parents, not making us the problem. About understanding what the research we next of kind can be. They are not a threat to the treatment, but a great research. And the system must dare to take the responsibility, dare to say that here we should have done so much more. Because if you listen, if you lose that ability to see, you will also lose the ability to save. Because I am a living proof for that this can happen. For if someone had seen us as a family, then perhaps Mina and Mille could be alive today. Today I'm living with an enormous grief, but I allow it to have a voice. I tell our story so that no one else will have to experience or endure what I did. I use my experience to tell what failure cost in lives, in trust, and in humanity. So, then I'm going to ask all of you, and it's not for answering me, but to answer yourself. When you see the next patient, the next mother, father, the next daughter, will you then see them? Or will you see the case? Because I am certain that the difference between life and death often lies actually there. Thank you.
Video.
Your video, they should.
Okay. At the time of Mille and Mina's death, I was county medical officer of Vestland, and we were tasked with preparing a report for the purpose of learning and quality improvement. And it is now 2 years since that report was made public. It feels longer. We hoped to write an investigation report with real meaning, one that could offer direction after what happened to Mina and Mille, Kirsti's daughters. Sometimes administrative processes and working in the civil service can appear as excruciatingly slow. The first government white paper in Norway to discuss the need for cooperation between children's services and other services dates back to 1982. And one question I have asked myself many times in quality improvement is that, do we see change? Do we see movement? So before this speech, we went through what has been achieved since the report, and there have been made legislative changes strengthening the obligation to cooperate and to include next of kin and patients in the analysis and follow-up after adverse events. As Cathrine mentioned, there has been established a national unit for review of system failures affecting children, with the purpose to identify failures and opportunities for improvement, and to share findings and recommendations with relevant stakeholders. A national pathway has been established outlining how child welfare and health services can work together to provide children and young people with good, coherent services. And I know that locally, the hospital units involved and child welfare and health services have worked on changes to prevent such tragic incidents and to improve their services. There may be people present here today who have been involved in the course of Mina and Miller's life, and I am sincerely glad that we have been working together in order to improve practices. But structural changes and changes on a service level are not enough. We do need to take responsibility, each and every one of us, as a society, as services, and as individuals, to work systematically and continuously to prevent something like this from happening again. And we can only move forward together. So I have reflected a great deal on a couple of simple words that carry much meaning. The first of those words are simply and or. As a doctor, I've heard many times the discussion is this substance misuse or a psychiatric condition. Is this the responsibility of child welfare or the psychiatric ward? Should this be handled by the local health services or the specialized health services? We need, as a matter of culture, as well as legislation and system changes, to replace the word or with and. This is child welfare and society and psychiatry. This is substance misuse and psychiatric conditions. And local health services, together with child welfare and specialist health services, need to team up and cooperate with the next of kin and the patient all together. We need for everyone to see the chain of services as a whole and to see the context around the patient, and to recognize that someone already sees the whole picture better than us, better than the health services providers and the health personnel. And those persons, next of kin, need to be included in the term us. They are the closest caregivers, family, friends, next of kin. Listening to them is good professional practice. Their stories help us understand the situation, the pathway, and they help us to understand the patient. Another important word is we. We, us, together. It's dark, counterpart, it's opposite. That's they or them. Those people over at the emergency ward. The people in child welfare. And of course, those people in the health inspectorates. They are a bunch of pencil pushers, only concerned with formality and legal questions. We need to abolish that way of speaking and talk about we and us together, the services, the patients, the caregivers, the next of kin, and also the civil services tasked with supervision and quality improvement. We are together in this, and we need to use language that brings us together. A very important point to me is that learning and improvement doesn't mean anything without change, real change. Change must happen in the structures, but also within each of us, in culture, attitude, and through good leadership that sets the direction for the changes we need. We also need to recognize the resources and the strength, but also the pain and the needs of the next of kin involved. And finally, to you, Kirsti. Before I met you, I had read a lot of documents, medical records, and I had tried to listen to the voices on those pages. And I have to admit that my impression from those documents, my expectation was that you would be a quite difficult woman. When I met you face to face, I have met a sensitive person, easy to talk with and genuinely constructive. I truly hope that when we meet again, we are able to change ourselves all the time and to listen, truly listen. And I can also say that the collective voice of the documents, the chorus of voices in the documents that I read, did not include your voice. And for that, I am truly sorry.
You had some slides. Your slides.
Not everything is going according to plan, apparently.
Is there anything you'd like to add to this video?
That was a collection of the news coverage when we presented the report, and you were present at that presentation. And it was a moment in time which I then thought was decisive and important. But now it's gone 2 years, so I have been thinking what are Kirsti's reflections now on the presentation then 2 years ago, and what has happened since.
I thought I would see more changes because our report was very hard. It was a lot of mistakes. And the journey that me and my girls had through the whole system, that result of the pictures you see there is in the spring before they got sick. And I thought that that heavy report that we got, I thought it would be easier to change the system. I thought it would be easier to see some changes that would help other kids and family that experience the same. But I see the will to the changes. But it's a big system. It's a lot of people working in it. And we have to start with some of the attitudes of the people that are working, that meet us as parents and the patients. But I thought we had come far that we have in over 2 years.
And Sjur, do you think that you've come far in 2 years? Were your expectations the same?
I think a lot has been done in the way of legislation and procedures and expectations, and we have also established new investigative bodies to promote quality. But what I think we may be underestimating is the ability for legislation to affect changes in the way that we think and act in practice. So what is to me a big question is how can we promote leadership in children's services and in the health sector that really promote these changes all the way out to the patient and the next of kin. And I'm not sure that we really know how to do that in an optimal way. So I'm so glad that we are here now in this conference to discuss this together.
Yeah, and hopefully some of our audience can be thinking a bit more about that. Before I ask you the one question I was meant to ask you, I know I've already asked you one. I just wanted to say thank you so much, both of you, Kirsti, for sharing your story with our audience, and Sjur for being here. When I was asked to chair this, I remember meeting with you and being really interested about the relationship that you had. And I think really both surprised but grateful that you'd felt heard through the investigation and the way that you describe it, that you expected to meet someone difficult and met someone incredible and sensitive and who had such great oversight of your daughter's journey, resonated with how I feel a lot of parents in the UK, where I work, probably experience our services. So your story is sadly probably not unique in the systems that a lot of our attendees work in. So as you know, we have 2 days ahead of us where I'm sure your story will stay with everyone. And they're going to go back to work in 2 days, very energized. But I know you both finished with a kind of a message or a takeaway, but what would be the one question you want our attendees to keep in their minds as they learn over the next 2 days, but also as they return to work and they're doing their day-to-day? Kirsti, do you want to start?
I think it's important to remember that the parents are in their deepest crisis. I was not this calm when my kids were sick because I was afraid almost 24/7. And it's important to remember that we have all the information. We are around these kids 24/7. So instead of seeing mothers like me like a threat to the treatment, take us in and give us, like I said, I wish somebody had seen me and somebody could have given me that hug that I needed when I was completely alone and my girls were having suicide attempts almost every day. So remember that not everybody can say what they have on their mind in this crisis that's through whole family. So take them in, give them a hug. And someone said, I believe that this is the biggest fight the parents is going through.
Yeah, amazing. And I know I can see Maureen in the front row, that wider question of what matters to you or what's front of your mind. And we had a conversation yesterday about how you can build trust in those relationships. And it didn't feel like anyone found that time to make sure that you felt that you could trust the people providing that care.
Yeah.
Sjur, what would be your one takeaway or message?
First of all, show people that you're listening, don't just tell it. And to all of the health leaders, I would say that everyone can do their little bit, and they can feel that they're doing a rather good job. But then it turns out very bad because we're not working together. So this is really a question of leadership. And it is a question of appreciating that communicating and including the next of kin is a basic clinical skill. If your service providers don't wash their hands, you would tell them to start doing it, and you would organize your hospital in such a way that they did. And you need to take the same approach regarding working with the next of kin. It's a basic clinical skill.
Thank you so much. Well, I'm going to bring our discussion to a close, but I'd like to say thank you once again for coming here and sharing, and for setting our day up like this. I'm sure we can all go into our sessions quite inspired. And thank you to the rest of our speakers who've opened and welcomed today. I know you probably don't need it after that discussion, but there is now a coffee and refreshment break in the community zone. But before I let you go, if we could just say thank you one more time to these amazing presenters.